book. We're all home, a lot of us working from home, social distancing, joined today by our president, Rick Trimp. And Rick, looks like you're working from home as well.
I am working from home today. I'm in mandatory isolation because of travel. And so I'm just about finished my isolation.
Well, that's good to hear. And COVID-19 has basically changed our world. It's disrupted all of our lives, personally, businesses, organizations. I'm sure LivingWorks is not immune to this. How is it impacting you folks?
Yeah, we've had a significant impact at LivingWorks. All of our face-to-face training obviously has really had to slow down, really stop, just because of the mandatory social distancing, the different groups of people, schools being out, businesses being out, and so it's really impacted our organization.
So you're right, the face-to-face trainings aren't happening right now, but there are still some great options that LivingWorks offers for people who, want to up their skills in suicide awareness and prevention. Can you tell us what is available right now?
Absolutely. So we do have LivingWorks Start, which is an online program that we developed about a year and a half ago and released it in April of last year. And what we've done is we've built Start out to be able to mass distribute Start, and it's a perfect tool for right now. We have society is really struggling because of uncertainty. There's a lot of fear out there. There's a number of people that are concerned about their livelihood, about their jobs, about what the future holds. And so we want to make sure that LivingWorks Start is out there in our communities, and that we're actually developing this skill so that we can identify those individuals that are at risk and make sure that we get them to safety and keep our population safe.
So a lot of people think suicide prevention training needs to be left to the professionals, but a program like Start really, it brings it back to us as individuals. It tells us that basically we all have a role to play.
Absolutely. Everybody has a role to play in suicide prevention. And we take very much a community approach to this. It's very similar to, it takes a community to raise a child, and everybody plays a role in that. And same thing in suicide prevention is that we all play different roles in our community. And LivingWorks has the ability to train individuals in different roles depending on what role they would like to play, whether that be awareness, just being aware that the issues around them, or being somebody who can identify, or somebody that has an innate skill in identification and being able to address an individual at risk, to somebody who can actually intervene in somebody in crisis. And so all those skills collectively can create what we call a network of safety. And that network of safety is really important for our communities. And that's really been the major focus for LivingWorks over the last 2 years, is to get people to understand the importance of having a network of safety, having options for different skills, and be able to roll out those skills so that we can create safe communities, whether that be a place that we work, where we play, where we worship, and where we learn. And so all those different communities of people, sub-communities, if you will, make up our larger community. And so skills at various levels are really, really important.
Would you say we need that network of safety now more than ever? I mean, we're in a crisis. Why is it so important now?
Well, there's a few reasons, Michelle. One of those reasons is because we're right now in the middle of globally a crisis, and people are being directed to isolate. And our normal psyche is to have connectedness, and so we believe that we can fill that gap of connectedness with the skills that we have. We need to be able to watch over ourselves, our family, our neighbors, and others in our community in a way different than what we've done in the past. And so this gives us a really important opportunity that we need to capture and to be able to watch over and create those safe communities. The second reason is because people are going through a time of uncertainty, and some of that uncertainty is very significant for individuals because they're really concerned about how their business is going to support them. They're concerned about what's the new normal, and we don't know. There's a lot of unknowns in this world and a lot of uncertainty, and so really, really important that we build this connectedness, and that people are trained up and that they have the skills to be able to watch over to keep people safe.
You know, we hear a lot about checking in on your neighbor, giving them a phone call. You know, do you need groceries? Can I shovel your sidewalk? It's probably a good idea to just check in on their mental health, if you will.
Absolutely, absolutely. This is a time when we're responding to a disaster today, and the response period will be over soon. But it's all about the recovery, and that recovery period is longer than what we all think. And so that mental health and the healthy mental attitude gets tried, and there's a lot of trials and coming our way, and we want to make sure that like you said, watching over our neighbors, watching over our loved ones, watching over our coworkers as they struggle through some of these times, and how we can lift each other up and make sure that our needs are met.
So can we dive in a little bit into exactly what START is? You've said it's an online training. I've taken it, Rick, and one of the things that I noticed and really liked about the program was that it encourages you to say the words, because I'll be honest, suicide it's a difficult word to say. It's really difficult to ask someone directly, but tell us a little bit how the program helps you through that.
It's a great question, and thank you for that question. The premise behind LivingWorks Start is that it teaches a little bit about awareness, but really gets into the skill of being able to identify individuals that may be at risk and how to approach that individual. And as you said, Michelle, to ask the question and to not be afraid to ask the question. It's critical that we overcome that, and some of that comes from our own beliefs. Some of it's fear that somebody's actually going to say, yes, I'm thinking of suicide. But it helps people get over that, and develops a skill to be able to ask that question so it's natural. And then also the skill of how do I take people to the next level of what kind of care that they would need. And so the program is definitely a world-leading program. It's one with very solid curriculum design. That is the latest in curriculum design, and we've had it researched, and it's been proven. We have evidence that it's actually proven to develop those skills. So outcomes is what we call them on all the levels of the ladder, if you will, of learning. And so we identify outcomes based on that. Sorry, I cut out.
It helps you connect these vulnerable people to safety. So let's talk about some of those organizations that are out there. Distress centers, crisis lines, they're really our partners in the network of safety. And I think they're being overwhelmed with calls these days.
Yeah, the latest thing that we've heard is that we're seeing uptakes of greater than 300% on our crisis lines. That's really great that people are reaching out, but is it okay now?
We're still good.
Okay, I got a signal across that said your microphone is muted. So calls to distress lines, our crisis lines are up by 300%. And so that's really telling us about what we call the psychosocial need out there. And so it's really great that people are reaching out. But people need to have. So I see a controller for a Xbox or something here in the picture. Is it okay now? That's what I see. I'll continue on. It looks like we lost Michelle here temporarily. So one of the things that we are doing at LivingWorks over this response period for the next 2 months is we're actually, as part of our social enterprise responsibility, finding some of these key resources and in our network, if you will, to make sure that we're giving back to some of those resources so that they have the ability to staff up to meet this need. And we feel that that's a responsibility of LivingWorks to be able to do that.
Sorry about that, Rick. Technical difficulties. Technology is great when it's working. I did hear your final thoughts, and thank you for that. So a portion of proceeds going to support our crisis lines and distress centers, really globally. So that's pretty amazing what LivingWorks is doing. Is there anything else I didn't ask today, Rick, that you wanted to mention?
I think one of the things that that I want to say is that you know, we're wanting to make sure that our training workforce is able to generate the ability to go out and create spread, and so one of the offerings to our trainer workforce is actually an opportunity for them personally to be able to go out and deliver START. And so we've created a mechanism for them to do that. And if any trainer is not aware of that, please access our website. And because we did send out a mass email earlier this week identifying that opportunity. And so if you haven't received that yet, please reference our website. The other thing I want to say to anyone who's online here is that please be safe, watch over your families, watch over your neighbors, and we'll get through all this together.
Yes, good words. Thank you so much, Rick, for your time today. We really appreciate it. Really important message. And as you said, we hope everyone stays safe, and we'll get through this together.
Thank you for your time, Michelle.
You're welcome.
All right. Bye-bye.
Bye-bye.